Hello and welcome back to Dr. Z's Health Education Project. In this video, I would like to talk to you more about the treatment of diabetic retinopathy. Specifically, I'd like to talk to you about what your doctor can do to treat some of the complications from diabetic retinopathy. Now, one of the complications is macular edema. So let's look at what is macular edema. Let's review that briefly. Macular refers to the macula, which is the center of the retina. So if we review on this diagram of the eye, this represents the front of the eye. This layer in blue back here represents the retina. And the very center of the retina is the macula. The macula is the part of the retina that you use for your central vision, for your main vision. So macular edema has to do with the macula, and then edema is a fancy word for swelling. So diabetic macular edema is basically swelling of the macula, which is again the center of the retina, due to diabetes. So let's look at what diabetic macular edema looks like. If I were to draw a sideways view of the retina, or specifically of the macula, it might look something like this. So if I took the macula and I took a very thin slice and I laid it on its side, it would look kind of like this. You'd notice that it has a certain evenness to it. It has a small dip here where the center of the macula, as we call it, the fovea. And that's sort of what a normal macula might look like. And in the macula are tiny little blood vessels that serve as pipes that carry the blood to the macula. So you might imagine that there's these little pipes here that are supplying blood to the macula. Now let's look at a macula that is swollen, or a macula that has macular edema. So rather than being thin, we might notice that the macula is now very, very thick and swollen. So if I were to then draw blue for fluid, imagine now that this macula is full of all this fluid, or the water component of blood. And then blood vessels not only leak fluid, but they leak blood. So let's pretend that there's some blood mixed in here amongst the fluid. And then blood also contains cholesterol. So let's draw in some yellow cholesterol deposits here. So you might imagine that a macula that's full of fluid and blood and cholesterol is not going to see very well. And where is all this fluid and blood and cholesterol coming from? Let's go back to these retinal blood vessels, these pipes, so to speak, that supply the blood to the retina. If you might imagine, diabetes over time damages these blood vessels, causing them to leak. So fluid and blood and cholesterol are going to leak out of these blood vessels, or these pipes. So imagine that you have pipes in the basement of your house, and then if these pipes get lots of holes and areas of leaks, then you know that your basement is going to get flooded with water. Similarly, if the pipes that supply the blood to your retina become damaged, they're going to leak, and in this case they're going to leak water, and they're going to leak cholesterol, and they're going to leak blood. So this gives you a summary idea of what is diabetic macular edema. Now let's move on to what your doctor can do to treat that diabetic macular edema. So one option is medication. Now the most effective medication for diabetic macular edema, unfortunately, isn't a pill that you can take or even an eye drop that you can take, but rather it's medication that gets injected into the eye. Now, if most of you are hearing this, watching this video and hearing this concept for the very first time, let me just pause and say here, injecting medication into the eye actually sounds very scary and frightening, but it is not a painful experience. If the eye is properly numbed and the procedure is done carefully, it is not a traumatic or painful experience. And many of my patients who have eye injections often tell me that it wasn't as bad as they thought it was going to be. And the purpose behind injecting medicine into the eye is to try to get these blood vessels to leak less. There are certain chemicals and hormones that are produced in the retina in patients with diabetic retinopathy that cause these blood vessels or these pipes to leak. And these medications stop that leakage. And I just want to introduce you to the concept that there are some medications. Some of the examples of medications include Avastin, Lucentis, or steroids. Now, the purpose of this video is not to go into the details of which medication is best for your eye. I just want to introduce you to the concept that the medications can be injected into the eye for the treatment of diabetic macular edema, and some examples of those medications include Avastin, Lucentis, or steroids, and your eye doctor can help you decide which medication is best for you. Now, whenever you think of any treatment, you have to understand the risks and the benefits. Now, the benefits to the treatment are that it can sometimes reduce the macular edema and improve your vision, or stabilize the vision and prevent it from getting worse. We know that patients with retinal swelling or diabetic macular edema that are left untreated will often slowly lose their central vision and get blurry vision permanently if left untreated. With treatment, we can sometimes improve the vision and often stabilize the vision. But there are risks and complications from having medication injected into the eye. I should point out that two of the main complications are infection and retinal detachment. Now, these are major complications and can result in vision loss, but fortunately, these occur less than 1 in 1,000. So for every 1,000 or every 1,500 or even every 2,000 injections that are performed, often results in one case of an infection. So it's a relatively safe procedure, and again, your doctor can talk to you more about the details. So if we say medication injected into the eye is one option, another option is laser treatment. How does laser work? Well, if you think that, going back to our leaky pipes analogy, if we have these pipes that have holes in them, if we can somehow create a burn in those areas of leakage, let's say there's an area of leakage here and we can seal that up by creating a burn here, or if there's an area of leakage here and we can seal that up by creating a burn, then we can reduce the swelling in the retina. So laser has been around for many decades as a treatment for diabetic macular edema, and many patients benefit from laser. Laser has its own benefits and risks and complications. Fortunately, there aren't very many risks and complications from a laser. It does not put you at risk for an infection or retinal detachment like injections do. On the other hand, laser is creating a permanent burn or scar in your retina. And if the areas of leakage are very, very close to the center of the retina, then laser can create a burn or a blind spot very close to the center of the vision. So laser has to be applied very carefully by your eye doctor. Now again, the purpose of this video is not to tell you that one treatment is better or which treatment is for you. This really depends on your eye, and it depends on a consultation with your eye doctor. But I just wanted to introduce you to this complication from diabetic retinopathy, which is macular edema, and some of the things that your doctor can do to treat it. In my next video, I'm going to talk about one of the other complications from diabetic retinopathy, which is the growth of new blood vessels into the retina. See you in the next video.